Welcome to State of the State. I'm Darlene and I'm in conversation with Aaron Guckian. He is the Executive Director of the Rhode Island Dental Association, and he is here to talk about the health crisis in the dental world right now. Welcome back.
Well, thank you, and thanks for inviting me for tonight.
Welcome. Last time you were here, you were running for Lieutenant Governor.
Yeah, it was a great race. I called Lieutenant Governor Matos and wished her well. Tried to do the right thing, as they say, and now I'm here. I'm delighted to be here and sort of talk about the current state of dentistry in Rhode Island.
Yeah, so tell us about this shift from politics to Executive Director.
Yeah, well, so when you lose, you kind of dust off, and I did a little bit of consulting to try to, as they say, keep the lights on, and then I was fortunate enough that I was invited for an interview for this particular position, and I took it. And I've had an unbelievable learning curve for the last year with healthcare and sort of the challenges in the state.
Okay, so what's your role there?
So I'm the Executive Director of the Rhode Island Dental Association. We're the leading advocate for oral health.
Okay.
We don't represent all of the dentists, but we represent a majority of them in the state. And it's the power of three. So you have the American Dental Association, which was founded in 1859 in Chicago. And they represent a little bit under 170,000 dentists, not only in all the states, but there's 3 territories. And then there's the state chapters. So we were founded in 1878.
Wow.
So it's so much longevity and history to this association. And then there's the components. So there's a northern, central, and southern component, and they meet once or twice a year to sort of talk about the issues that they're seeing, and to try to kind of bring everyone together so they can not only socialize but also try to find solutions and help the situation in Rhode Island.
Okay. How many members are in this chapter's association?
We're probably around 65 to 70%. We're just finalizing the numbers now. I would say in the high 300s, maybe 400. Active, I know there's a little over 500, give or take, of dentists in the state. Maybe you could go as high as the high 500s, but some of them are semi-retired, some of them have dual licensure. So it's, I'm going to probably get all the final data in the middle of May. Okay,
and has there been a drop-off?
With dentists?
In members, maybe because there is a shortage of dentists? Or?
Yeah, so we're aging out, and across the country, there's an issue with workforce, and that's kind of across the whole country with doctors and nurses, and in our industry, hygienists, dental assistants. But unfortunately, in this state, it's heightened. We don't have a dental school, which is a big thing, one of the few states that don't. And we're not very competitive in our region and with reimbursement. And sort of the tax structure, as you know, is tough on small businesses.
Yeah, and so what about the state of our small businesses, like the lure of coming into the state to work, set up shop?
Yeah, so the dental schools that are close to us are University of Connecticut.
Okay.
We have Tufts, Boston University, Harvard, and then the University of New England, which is Maine, and we try to draw upon them.
Okay.
Unfortunately, we have one of the largest percentages of young dentists that have left the state in the past 3 years. And one of those reasons is because of the reimbursements to the West in Connecticut, Massachusetts, and New Hampshire. So across the country, if you look at the salaries, it looks like we have a high salary. But between overhead and the lack of competitiveness, I would say, with Connecticut and Massachusetts, if you're a dentist or hygienist, you could probably make upwards of 25 to 30% more just going over the line.
Wow. Yeah. So we don't have a high reimbursement rate. It's expensive to set up shop here.
Yes.
The cost of living here is relatively high. So what do we do? Where are we at, and how do we fix this?
So in 2022, the last election cycle, Massachusetts passed by 72%, something called medical loss ratio, which means that 83 cents to the dollar, or 83%, go to patient care rather than administrative costs. And it was a real
So what does that mean? Break that
moment.
down for us. What does that mean exactly?
So it just means that right now with the premiums and what you would go to, let's just say you go to the dentist, we're really wanting those premiums to go up. So for example, if you went to an endodontist, which is a person that if you have a problem with your tooth and you need a root canal, a root canal kind of wipes out that gift card, if you will, of about $1,500 to $2,000. And then you have to have a crown. Well, what we're trying to do is get a little bit more money in that premium so you can get more care. And then you actually have a straddle effect, which is also puts a lot of pressure, meaning, let's just say you get the problem with your tooth and you need a root canal and you get it done in October, even now sometimes, and people stretch it and then they'll try to make an appointment in the first of the year so then they can get the crown and they don't have to pay out of pocket for all of it.
So right now, many people do pay out of pocket for a root canal.
Correct, and they call that fee for service. So if you don't have dental insurance, it's all cash. And I think I also wanted to emphasize that dental industry and optometry, but I'll speak to dentistry, is the two that weren't put in the Affordable Care Act. So if I went out and I have, let's say, for example, Blue Cross, and I have an emergency, I break my arm, they'll pay for a majority of those costs. Unfortunately, in dentistry, if you have a major need, let's just say you have to have multiple implants, or especially for our older folks out there, it can get very, very expensive. And the other thing is, it doesn't roll over. So for example, let's say you have 2 cleanings, you don't do much in regards to your dental insurance, and let's say it's only $500. Well, you'd think that some of that could maybe cross over the next year because you can use it. That's not happening either. You either use it or lose it. So it's something that we're advocating to get those reimbursements up. I think that our Medicaid population is another thing I'd like to talk about.
Sure.
And we have a higher Medicaid population.
Let me just ask you, so that same person that breaks their arm,
yes,
if they had a tooth break or some trauma here in the mouth, how is that not covered by the emergency visit? Wow.
Yeah, so what happens is, you get your certain amount paid for, and then you have to figure out the difference. There's something called Care Credit, which is a way that you can work with a credit card company and you can extend it, which is a nice option, but it's fairly expensive with the interest rates.
Right.
So, but that's one way that you can get around it.
Okay.
So yeah, and so we're trying to kind of mirror the Affordable Care Act with our bill, the Fair Share for Dental Care, where 85 cents to the dollar, which would mirror Affordable Care Act, goes to patient care rather than administrative costs. It mirrors the bills in Massachusetts that...
Yeah, so break that down again. So the 83 cents to patient care, what does that mean exactly?
Well, it just means that you'll get every dollar that's spent will go to patient care, and then the other part would go to the administrative costs to run, let's just say, the nonprofit or whatever dental insurance company that is.
Okay.
And they've just gone through the regulations. It took them it was supposed to be done in a year in Massachusetts. It just happened last week. So now we have they have a massive competitive edge, Massachusetts, compared to us. And so if we don't make an agreement, soon, it's going to be very, very devastating to this state because of what I just outlined.
Okay, and what were you going to say then about the insurance companies?
No, it's just, I think that, there are partners here in the state, and we've done a great job of organizing. We have our bill up at the State House, and, hopefully we can come to an agreement or maybe a compromise. And so as we kind of get to the end of the legislative session, my hope is that We come to an agreement, so they kind of come up and we're competitive. And there's a few other things I can touch on in regards to other legislation that I think would be helpful.
Do it.
Yeah, so kind of flipping, so there's dental screenings for our children. And our dentists will go in, they have a contract with the city or town, and they'll go through all the schools. Right Smiles with United Health, they have the contract currently, and it's very competitive. The problem is for example, in our urban core, and in Providence specifically, and this is kind of after COVID, they didn't get their cleanings. The federally qualified health centers, such as the Providence Health Center, they're overwhelmed. Samuels, which is on the Lifespan campus, is not accepting new patients. And so it should go, when they do the screening and they do the write-up, it should go from the nurse, the school nurse, to the parent, and then to the federally qualified health center that they make an appointment. Well, you have this kind of log jam, and the children aren't getting in there. They have massive issues. And one of the things that I'm proud of is that we have model legislation that Senator DePalma is putting in on S2751, I believe. And what this will do is, hopefully, right now, if you have a healthy child, or let's say a child with special needs, and they have emergent dental issues, what typically happens is there's a dental surgery center, and in states, and they'll come and they'll get anesthesia or nitrous, and they get a facility fee for that. Right now, ours is $250. And so therefore, none of the hospitals or the ambulatory surgical centers are inviting, let's just say, our oral surgeons or pediatric dentists to come in.
Yeah.
This would take it up to $1,700, which then would make it a lot
more attractive.
Yeah. Thank you. And there's a code from the Biden administration through, I think it's CMS, that it's sort of married as long as the state participates. So if we can get that through this year, that would really be helpful, because we have just so many children that are not getting the help they need. I'm getting constant calls from different mayor's offices with kids with boils in their mouths, infections that need to be seen like yesterday. And so I believe that if we can work with the legislature and our insurance companies to hopefully get those reimbursement rates up to a competitive level, pass this bill, we could really change the landscape. And then I can then start to recruit, if you will, some of the dentists. So when they're starting to retire, the average age of the dentist is way over 55.
What's the average age in the association?
We're kind of finalizing those numbers. I would say between 58 and 62.
So close to retirement.
Correct. And if you try to make an appointment right now, you're going to wait, and it's going to be a long time. And I really want to emphasize, those are general practitioners, but our specialists, such as the oral surgeons, the pediatric dentists, the endodontists, the periodontists with the gums, that's where we're really low.
So an orthodontist, I assume, too?
An orthodontist,
Okay.
yes. So I forgot the orthodontist, so I'm sorry to my orthodontist. But like, for example, our oral surgeons, we have less than 30.
In the state?
For 1 million people.
Wow.
And so if
and do you know what the average age is?
Well, again, we have people that some of them are in their late 70s and 80s.
And they're still practicing.
They're still practicing sort of that old school, and we're so grateful for their help. And it's just things that need to be addressed. I don't think we've been very quiet for a long time, and we're advocating, and people are hearing us. And I appreciate it. I appreciate what people are doing. And I'm not demonizing the insurance groups at all. I think that everyone's kind of waking up and saying, all right, let's see what we can do. So that's my hope.
Okay. What happened during COVID?
So, like everybody, our dental offices were closed, and then it took a little while to reopen, and a lot of people got out of those patterns. So, and then specifically, I would say our lower income, and then the urban core and some of the people in the rural areas, where they had those appointments, then they stopped the appointments. Then there's transportation issues, which is another problem. And the children that might have been seen every 6 months or at least once a year, now they forget about it. So I've gone and done some presentations in some of the schools, talked about career pathways and dentistry with hygienists and dental assistants. We have our only accredited hygiene school, which is in the community college in Rhode Island, Lincoln campus. We talked about that, and I said, by show of hands, who's the last person to get, cleaning? It's not a great number. And then what I've heard from the principals is even hygiene has been, and I see that everywhere, kind of people are dressing down, they're more in baggy clothes, and that's sort of, there's no judgment on that, but it's sort of created this lack of attention to detail, specifically with flossing and brushing and mouthwash.
Okay.
So if you're constantly talking about it now, and we're kind of getting that awareness, getting in the schools, talking to the teachers, I think it's getting better.
Okay. So practices were closed. I'm sure plenty of dental professionals retired during COVID.
Yes. And hygienists.
And families got out of sort of their routine of twice a year, once a year, getting checked. So then this is a problem now, right? So this is and what does the enrollment at the dental school at CCRI in Lincoln look like? What does that enrollment look like?
So they are, with the hygiene school, they have so many members. I think it's like about 40, but I'll just pause because I'm not a subject matter expert, but they have pretty much all the hygiene chairs, if you will, filled.
So the school is doing well?
Yes.
Okay.
But we're not pumping out enough. And then with our dental assistants, much like the CNAs, it's harder to get people because of, if you're going to make $20, let's say in the restaurant business an hour, per se, we'll say, or you're going to make $20 as a dental assistant, there's a lot more training, there's a lot more stress and pressure. Whereas, and I'm not saying that.
And you come out of school probably with
some debt, yeah.
Yeah, and if you don't have a job.
Correct. Now, some positives. Hygienists are making a really good living, and it's only a 2-year commitment with some prerequisites involved. So call it maybe 2.5 years. And it's only, I think, about $10,000 a year. So if you could go to that school, you could come out and have a great living. And then you also, it's hours that are sometimes flexible. You're not working, 60, 70 hours. So if you're a mother or a father and you have children, that's something that works. The dental assistants, usually they learn the craft. Sometimes they become in the front office, and that's also a great job. We're looking at a certificate program, possibly with maybe the Community College Rhode Island or another partner, because there's also a gap there where some of the people that are doing all the coding and processing and the QuickBooks, you really have to learn dentistry, what the number of the tooth is, and all these sort of intricate parts that are unique to dentistry, and there's a sort of a skills gap. So we're hoping to work with maybe CCRI or another group to work on a certificate program to kind of fill that gap.
Ah, okay.
Yeah.
What does a dental hygienist make coming out of school?
Yeah, I would say probably between 40 and 55,000. And then if they hustle, right, and they make certain hours, they can get up to that. But I know that we would say at least 45 to 50 an hour, and it can get higher because there's not enough of them, and they work very, very hard, and it's very detailed. So they're valuable, and that's another thing that we hope some of these different types of reimbursements, such as hygiene, pulling teeth, like extractions, crowns, if we can get those up, I think it would be helpful to everybody.
Okay, so $45 to $50 an hour coming out of school doesn't sound so bad.
Yeah, and now, some of them are younger. They might start at a little lower of a rate, but there's such a need for them that's so competitive that even people that don't have a long history yet in regards to background they might get plopped into an hourly rate that's a little higher.
Yeah, but what's the cost of living in Rhode Island compared to that? Like, so a single person graduating from school with some debt, living in Rhode Island, can they?
Yeah, I mean, the margins are getting harder and
$45,000 a year?
harder. I mean,
Okay.
food, we all know inflation's up. We know how difficult it is. But it's a great job, and usually you move quickly now.
Okay.
So you can move up pretty quickly, and then you can kind of negotiate. But that puts a lot of pressure on the dentists because the overhead, all the dental supplies are getting higher. And then, something I really want to emphasize is our dentists that are in the East Providence or East Side. Because of the bridge issues, our dentist offices are really struggling because the timing of the different, let's just say you're a mother, you're trying to time it, you're late for your appointment. That messes everything up. Or you're early, and then let's just say the hygienist is late or the dental assistant's late. And everyone's trying to adjust, but I know from the dentists that are in those areas, it's been really crushing.
Yeah.
So we're talking to partners, the stakeholders, the mayors, the town council people, all the way up to our congressional delegation. And I think everyone hears us. I hope it speeds up because some of them are even struggling making payroll. And if they weren't as, let's just say, senior and have already done very well in their life, they would, if they told me if they started, they might have been out of business. So it's something to sound the alarm. We're working with our elected officials. I know everyone hears us.
Yeah. How are the elected officials receiving this?
Yeah, I think that in regards to the bridge, we had that crisis in Baltimore. And now, unfortunately, or I would say fortunately, this bridge wasn't an emergency. The problem is then the formula gets messed up. So when I was the chairman of the Warwick Sewer Authority, people probably remember in 2010 we had the flood. Well, we got 90% after we went through the process of all of those monies the feds covered, and then the city and state, and we're a quasi, had to pick up that. I know because of what happened in Baltimore, there is a relief act in the federal, and then hopefully we can clip onto that, meaning our state, so we can get 80 to maybe 90% of it funded, and then we can get hopefully the money into our state, and then they can start really, pursuing the construction that's needed. And I don't, I'm not an expert in bridge. I know my father's a local 51 plumber, but it's something that needs to be addressed immediately. And there's been sort of this gap. So it's an appropriations time down in the federal government. And I hope that those monies come in, and then there's some relief with grants, not just the loans from the Small Business Administration, where people don't want to take loans when they're this concerned. They need an infusion of money so they can kind of make it up. So we'll see how it all works. It's all kind of new territory, and God willing, we kind of can fix this problem.
Yeah. So who are you working with to create these bills?
Well, so I said the Power of Three. The American Dental Association is a powerful lobby, and they're working with the Congress. We had Lobby Day just a few days that actually coincided with the Rhode Island Lobby Day. So we talked about it. I couldn't thank Senator Reid, who sat with us.
Okay, so I'm wondering, who in our government is on board, or you've talked to that's a support?
Senator Reid, he's the chairman of the Armed Services, and he talked to us for 15 minutes. And at that time, there was a lot of things going on internationally. So, he was incredible. He talked about it. We worked on it. The two congressmen, Gabe Amo and Seth Magaziner, heard and said that we got to help, and we're going to try to do what we can. Obviously, Senator Reid, with his longevity, seniority, and position, can really advocate. At the time, there was a conflict for Senator Whitehouse. We weren't able to talk to him, but then I was able to talk to him at night. And so everyone understands the problem, and I think that they're really going to work hard for us.
Yeah. Okay. So we have 5 minutes, and it's is it Dental Awareness Month? What is April? April is.
It might be Dental Assistant Month. I'm not sure. I know February is National Children's Dental Health Month, which is something we really talked about. We got into schools. Marie Jones-Bridges from United Health and Right Smiles, who's a hygienist herself. We got in there. We worked with partners to really talk about hygiene and then again career pathways. So, as I go around the state, we have so many talented people. People are tired. They're stressed out, and but they're doing whatever it takes, and we're really getting up there. We had over 30 of our senior dentists do testimony on the Senate and the House side. We've worked and talked to people and advocated, and I feel really, really confident that we're going to get something done. It might not like everyone, you got to compromise, but I'm really excited because there's solutions there, and some of these bills could really be helpful. And there's something called the Mission of Mercy, which is in October.
What's that?
On the 5th and 6th. It's a free dental clinic, and they do it for adults. It starts as early as 4 o'clock. And
4 a.m. or p.m.?
4 a.m.
Oh my goodness.
So people line up. It just talks about sort of the crisis. And then they process them and they go through, it's like a MASH unit. And it's incredible what they do, but hopefully it's not as necessary if we can get these sort of changes.
Where's that happening, Aaron?
October 5th and 6th, it's a Mission of Mercy. It's happening at the Providence Health Center on Prairie Avenue.
Okay.
And it's something that, I'm going to be calling our corporate partners to hopefully donate a little bit more money, and the dental sector. It's just massive. I mean, you check out the ads, you see Colgate, you see Invisalign, you see Crest, and it's just, it's a massive industry that not a lot of people talk about until they start to think about it. Yeah,
so we have less than 3 minutes.
So
anything that we haven't covered?
Well, I'm really excited. The board president of the American Dental Association, she'll be in town May 21st and May 22nd. It's a big thing for our state. The board president hasn't been here in a long time. I want to thank our dental community for all the hard work they do. We really need to get sort of dentistry and our hygienists back into the schools. There's a great program at CCAP called the Molar Express, where they have a van with dental chairs, and they can get the children right out of school and work on them. They do that in Newport, at EBCAP. These are federally qualified health centers. They do some of this at Blackstone Valley Health, which is in Central Falls and Pawtucket. We have 7 total. But in regards to our urban core in Providence, there's a lot of different things we can do to educate. RI 365, what the governor's doing, we're working with the governor's office to try to get, Colgate has this Bright Smiles, Bright Futures program, which is all in different languages, and it really talks about oral health, to educate parents about good nutrition, good hygiene, and to hopefully stop this terrible pattern that we're in and change it.
Okay, so 1 minute, we have 1 minute. What can we do, citizens, what can we do?
Well, I would first call your legislator.
Okay.
Whether it's a state senator, state rep, you can get that at the Secretary of State's website, or just Google your zip code and say, I really support the dental legislation. I support our dentists. I can't get an appointment right now. We're struggling we want more patient care. And so if we can sort of make an agreement, like I said, and kind of put the pressure on, I'm quite confident that we can work with our insurance, the dental insurance companies, to hopefully find a solution. Okay, great. Thank you so much for coming back. Yeah, thank you. Thanks. I'm Darlene DeRezzo. Thanks for watching. Please find us on social media. We have a new Instagram account that's called State of the State RI.